Call the member for Werriwa.
Thank you, Deputy Speaker. I move the motion relating to Pregnancy and Infant Loss Remembrance Day in the terms in which it appears on the notice paper.
The member for Werriwa's call.
I'm a mum of 5, 3 boys aged 36 and 30 and a boy and a girl who died 38 and 32 years ago. When asked about my children, I don't always add Michael and Megan, not because they're no longer part of our family and certainly not because I don't think of them regularly, but because I don't always have the ability to talk to people who haven't suffered the loss of a pregnancy through miscarriage, stillbirth or neonatal loss. Reactions are wide and varied. In the early days, I felt like people shied away from me. I'm sure that was because they didn't know what to say, and for good reason, they just didn't know how to help. But acknowledging the loss and the child by name makes such a difference to a grieving family. Ours is a club no one wants to join, but this year more than 110,000 Australian mums will experience a miscarriage. October each year is Pregnancy and Infant Loss Awareness Month, and Sunday the 15th of October was Remembrance Day, when families throughout this country light candles to acknowledge the babies who are thought of often but no longer take a place at the family table. Although Australia is one of the safest places in the world to give birth, around 6 babies are still born and 2 die within the 28 days of birth in the neonatal stage, equating to around 3,000 perinatal deaths a year. And sometimes that's what makes the loss the hardest, because there's so few of you and you rarely know someone in the same situation. But if you are an Indigenous mum or come from a cold community, you're up to 50% more likely to suffer a pregnancy or baby loss. This figure is stubborn and hasn't changed in the 8 years I've been in this place. Indeed, the figure has not substantially changed for 30 years. More research is needed, but access to good, reliable prenatal care is also essential wherever you live. The Albanese Government, through the 2024-25 budget, has dedicated $9.5 million to improve care and support provided to women and families experiencing miscarriage and early pregnancy loss. This included $1 million over 2 years to the Australian Institute of Welfare to undertake a miscarriage data scoping study. The study will support work to better understand miscarriage and help to improve the support offered to women and their families, because if you don't know what's happening, you can't help. $1.5 million over 2 years for a national audit of early pregnancy assessment service clinics. Improved information can be used by GPs and other health professionals to ensure women experiencing pregnancy loss and other early pregnancy complications are referred to the proper specialist services where feasible. $1.5 million to develop miscarriage education and awareness resources, including public awareness and education programs, and $5.5 million over 4 years for frontline miscarriage support services to provide evidence-based, culturally safe bereavement care and support for women and families who've been impacted by miscarriage. And funding of $0.9 million over 2 years was also announced to continue to monitor and evaluate activities under the National Stillbirth Action and Implementation Plan. This is building on funding from previous budgets for the continuation of Red Nose Australia's Hospital to Home program, which provided services for over 2,000 Australian families who experience stillbirth each year. Funding to deliver high-quality, evidence-based bereavement care for women and families from high-risk population groups that have experienced stillbirth and miscarriage, especially those from First Nations, culturally and linguistically diverse communities, and those families living in rural and remote areas, and for women younger than 20. This also includes direct bereavement counselling and training for health professionals. There are encouraging signs that the research will help families and babies reduce the rate of deaths and miscarriages every year, but more importantly, families will feel and be more supported in their journey of loss. To every family whose babies are no longer with them, I share your pain and remember your loved ones and acknowledge them.